Dr. Winters here with Jennifer Hunt, and we want to talk about the point today that you don't get a second chance with your brain.
Yeah, I did. What exactly do you call that thing that I did?
Neurofeedback?
Neurofeedback?
Yeah.
The full, this full brain workup is what I called it. And I kept a journal the whole time, and I didn't realize how the decline that I had. I just started noticing not being able to remember things and losing words. But then as it got better, you don't know how bad something is till it starts getting better. And the results were lovely, and they're still going on. And this is so true. That was the best time and money that I've spent. I can't redo my brain once it starts deteriorating.
That's right. So many people wait till they're having trouble with daily activities, and then a daughter or a son brings them in, and by that time there's only a limited amount that we can do.
Yeah, I think by the time the family starts doing intervention, to tell you something's wrong, it's gone further than it needs to go. And I'm going to be 60 this year.
And it's gone further than it's possible to get the ultimate results.
To pull it back.
Yeah.
And I just started noticing that I was losing words. Like I'd be talking, and it's like regular words that I know, or names that I know as well as my own, and couldn't remember where anything was. And I have some declining family members, and so I was aware of what this looked like. And that's not who I want to be. And so I've got to start taking care of that now. And I didn't realize how far things had slipped until they got better.
Yeah, and this can happen at any age. We have several patients that just started with us recently that one lady had somebody tell her, do you realize you've told me that story 3 times this week and you thought it was new each time? She's in her 40s.
Yeah.
Having a lot of trouble. We had somebody in their 20s with all kinds of neurological symptoms that actually started to drive someplace and got lost for a moment. Now that's a different inflammatory issue, but still it's got to be taken care of when you're young. It's probably gluten ataxia in her case, but meaning gluten is damaging the nervous system.
Well, and the nice thing for me, the patient, is it's pretty passive. I mean, I didn't really have to do anything. The process does what it needs to do. I'm not having to do 20 push-ups and a set of sit-ups. And, there's not this, I got to work on this. It is a process that works within your body. And I think it's kind of like when people get glasses and they've never had glasses before. They don't know how bad their eyesight is till they get glasses.
Yeah.
Or you get new glasses. And it was like, wow, okay, I didn't realize how far this had gone.
And what Jennifer did was neurofeedback, which is the computerized brain training where there's some sensors on the scalp and the computer reads the brainwave activity and cues your brain when it's moving in the healthy direction and doesn't cue it as much when it's not moving in a healthy direction. So it's very, as she said, passive, but there are active things that a person can do as well. And in your case, you've already done a lot of blood work and different things and got those parameters under control.
Yeah.
So if a person is not doing lifestyle things, not eating good, not exercising, etc., then we have to bring in all those things into play.
All the components. Well, and the thing too is, as you're sitting there doing this, I mean, you're just sitting there relaxing, looking at pretty pictures. There's this just pretty little things on the screen. And it doesn't take long. And I can't think of very many things I have done for myself that is going to give me as long term. I'm thinking when I'm 80, I'm going to be looking back going, I'm so glad I did that.
Mm-hmm. Yeah.
Just the awareness.
Yep. So we don't get a second chance with our brain. So as soon as you notice something off, get some help.
Yeah, most definitely.
Dr. Michael Winters, Winters Wellness, Chiropractic Redefined.